Hey guys, it's Dr. April Lynch coming to you from Bluegrass Veterinary Hospital here in beautiful Gallatin, Tennessee. We are continuing on in our 5-part series about the healthy habits of the diligent pet owner. This is part 4. Today we're going to talk about giving medications and supplements to your pet. Now most of you may not think about this, but during the course of your pet's lifetime, most of you will have to give some sort of medication or supplement to your pet. And I'm going to help you get prepared on doing that. So the frequency with which you may give these medications will vary. So sometimes your pet may be on a daily supplement lifelong, whether that's for arthritis or some sort of health issue that they have. Other times you just give it periodically, like monthly. We definitely recommend that monthly prevention for flea, tick, and heartworms. So it might be that you're just giving it once a month. And then other times it might be that your pet has a sudden illness or medical condition and you would have to give a medication frequently for a short course, say a week or two. So we want to help get you prepared for those situations. And there's different routes that you can give medications at home, and this can vary, and some are much easier than others, as you can imagine. So there's various ways to administer medication to your pet at home. Most of you would probably think of orally as being the most common, and it certainly is. And there are pills, capsules, liquids, pastes, and all sorts of other ways to give those medications, even a chew that your pet might accept as a treat if you're lucky. There's also topical. Sometimes we just ask you to apply a liquid or some drops or a gel to a certain part of the body, or a spray to a certain lesion or wound, or bathing the dog, putting the entire animal in the medication or the medicated shampoo. Some of you may have to give medication at home through injections. So say your pet has diabetes. You may have to give insulin daily to your pet, and that definitely requires a lot of know-how and skill. So let's talk about the oral route, which is the most common way that we give medications. So the easiest way to give oral medication, of course, is to feed it. And if you're lucky, it may come as a treat. So a lot of the manufacturers that make the heartworm medication and prevention that we give to our pets monthly, they have disguised it as a big chew. And a lot of dogs love this. Sometimes even cats will accept this as a treat, and you merely just hand it to them. They think it's a reward. They're excited. Once a month, done, boom, easy. However, not all medication is that easy. Sometimes it might be a very disgusting flavored liquid that you have to force down your cat. That requires a lot more skill and know-how. Or it could just be that it's a capsule that your pet, after the second or third dose, realizes, I don't like this and I'm not gonna do this anymore, and I'm gonna run and hide from you every time I think that you're about to do this to me. So we have to get a little more creative. So a lot of people will call me and ask, Dr. Lynch, how do I get medication into my pet? They won't take it. It doesn't taste good, they're running and hiding, or maybe they're not even eating right now. Obviously, if the medication is a flavored chew, you can give it as a treat. If it's a pill or a capsule, you can hide it in their food. And I strongly recommend the best way to give those medications would be to use their own food. Rather than pulling something out of the pantry or the refrigerator that they're not used to eating, I would recommend just using a little bit of canned food, or if you don't have their diet as a canned food, you can purchase some over the counter or at the pet store and make a small meatball and disguise that pill in the middle of your meatball and feed it to the pet that way. So a lot of people will use bread, cheese, and various other things from the pantry, which can be okay. However, some pets, this could severely upset their digestive system. And so you might feed them one piece of cheese and then you're back in our office because your animal is having vomiting or diarrhea or suddenly doesn't want to eat. So I recommend that unless your pet is used to eating those things, I would not deviate from their normal diet. First of all, that way they are not expecting that there's something coming at them, and secondly, it will not cause any unwanted symptoms like vomiting or diarrhea. So one recent little cheat that we've discovered that's probably been around for a long time, but you may not have ever used them before. They're called pill pockets. And they make these in various sizes, various flavors for dogs and cats. And they're just a little piece of chew. It's made of some dog food and some other things. And you just pop the little pill down inside and pinch it around. It's very small, and oftentimes your pet will receive this as a treat, and you don't have to get out a lot of food or things from your closet. And cats and dogs will accept these, and they're much easier to make sure that the pet got the entire dose. So I highly recommend these, and you can find these at your veterinarian's office or usually at a pet store. The pros of this method of hiding the medication is that it's not as stressful on the pet or on you versus other methods of giving it. Your pet might receive it as a reward. It can promote bonding. It won't cause a food aversion per se. So all these things are positive. However, there are a few cons, and one is sometimes we're not certain that the animal ate all of it. Say if your dog gulps down this meatball and you think that he ate the entire thing and he got the medication, and then he runs out into the backyard and he regurgitates or spits up a little bit of the meatball and there's the pill, or he's just hiding it in his cheek, which some animals do, especially cats. They're very bad about hiding that medication, and then you walk away and they spit it and you find it later on the floor, or you don't find it at all. So one of the downsides is that we don't know for sure, did your pet even get the medication? Did they get all of it? Did it go all the way down? That's the main downside to this method, is that you may not know at all if your pet got the medication or not. And certainly if you're using lots of creative things to get your pet to take it because they won't eat it in dog food or in a piece of bread or something bland, you have to whip out the Ready Whip or the Cheese Whiz. Don't necessarily recommend those, but sometimes that can cause your pet to either have an upset stomach or to think that now every time they are fed, they should be getting Ready Whip or Cheese Whiz, and they won't eat without it going forward. That's happened many times. Oftentimes I just recommend putting the pill in the back of the animal's throat, washing it down, causing them to swallow, maybe putting some water in there, offering them something to drink. That way we know that they got the entire dose. We know that it's where it's supposed to be. And it's, sometimes medication is just that important that we don't want to chance it by putting it in a meatball and hoping that they got it all. So I will show you in just a moment how we do that, but it's really just as simple, if your pet is amenable, to opening the mouth, placing the pill between your thumb and forefinger, way against the back of the mouth, right over top of the tongue, the very back of the tongue, and then close the mouth. Oftentimes I will kind of blow in their face to kind of cause them to take air in and then swallow. You can rub the throat, you can put in a little bit of water through a syringe and they will swallow, and then you give them a moment to make sure that you've seen them visibly swallow, open the mouth, make sure it's gone, and usually it's as simple as that. Of course, I make it sound easy. For some pets, it's anything but easy, and sometimes even we can't, as professionals, get an animal to take the medication this way, but it's definitely worth a try if you know what you're doing, and you certainly can learn this at home fairly easily. So this is Rally. She is a great little patient. Sit, Rally, sit. Okay, so if I need to give her a pill, I'm gonna pop open this upper jaw here, poke it in the very back of her throat, kind of hold it for a moment, and you're gonna wait until you can see her swallow. You can see them swallow by like clenching their jaw, or when that tongue comes out, boom, done. And she says, can I have some more? Again, you may want to rinse down with a little bit of water or some food to make sure that it goes down safely, but that's it. So obviously the pros of this method would be that you ensure that the pet got the medication, everything, there's nothing left to chance or to guessing. However, the obvious con to this method is that your pet may become stressed, agitated, certainly not through malice, but they may bite you just because accidentally they're trying to clamp that mouth closed. They don't want any part of what you're doing. And certainly you or your pet could become injured in this process. Now, remember we talked about previously getting your pet used to having their mouth treated with like different dental products, brushing the teeth with the finger brush or with the toothbrush. If you're doing that at home, your pet is a lot more used to and willing to accept you manipulating their mouth, opening their mouth, putting things in their mouth, and certainly giving a medication is going to be much easier if you've taken that time to do that. So a couple of quick cautions and things to keep in mind. Some of the medications that we prescribe can actually burn the inside layer of the esophagus, which is the tube that goes between the mouth and the stomach. So it's important if you're doing this method, forcing the pill down, that you follow the medication with some liquid. First of all, to make sure that it doesn't just kind of sit up here at the top of the esophagus, but also for those medications that can actually agitate or irritate the lining of the esophagus, it's important to get some liquid in there, wash those down, make sure they get into the stomach. Also, if you're giving your medication through the skin route, a lot of times medications for cats can be compounded through a compounding pharmacy into what we call transdermal, which means they can make a very concentrated liquid that you can rub on an unhaired surface of your pet, such as the inside of the ear. And with those, very important to remember that you need to wear gloves, because if the medication is absorbed into the skin of your pet, it could also be absorbed into your skin. So I hope these tips have been helpful to you. As usual, please like and subscribe to our channel. And until the next time, we'll see y'all later.